Good morning. Thank you for joining us today. Today, we're going to talk about best practices in building maintenance, but we all know that a lot of this focus is on COVID-19 and understanding the impact on us and our buildings. We know that there's a tremendous amount of information out there. It impacts this changing landscape of facility operations. But we're going to try and zero in today on very specific things. Things, for example, best practices that Baker Group is applying to help make sure that our people stay healthy, because frankly, that's the first step to keeping your people healthy when we interact and work together. We're also going to talk about some building operational strategies. Many of you have minimal occupancy. Some of you have buildings with zero occupancy. What do I need to be doing during this time? And then there's a period of preparing for occupants' return. As we all know, this can't last forever. So that we've gone through a lot of the ramp up time. What happens when people come back? During the entire webinar, there'll be an opportunity for you guys to ask questions. There's a spot where you can ask questions on your screen. They'll come back to us and we'll bring those together and get all of those questions answered as best we can at the end of our broadcast today. And if we've done some things right, part of the summary should include some of your notes about action items. Maybe there are some ways that we can help you with some of these challenges in your buildings. Today, we'll have two moderators and a group of 4 panelists. My name is Daryl Karloff. I'm Executive Vice President of Building Services at Baker Group. Brandon?
Thanks, Daryl. As Daryl mentioned, today's focus is really about people and buildings. They're so interrelated during this time. And as such, we've prepared a panel of kind of subject matter experts within Baker Group for each of those disciplines. As Daryl mentioned, Daryl is on here. He is our Executive Vice President, Building Services. My name is Brandon Hummel. I'm Vice President of Development at Baker Group. We also have Ryan English, our Operations Manager for our Service Business Unit, as well as Dale Drent, Licensed Engineer, who's Vice President, Head of our Service Business Unit. In conjunction with both Dale and Ryan, Cindy Summers, our Chief Human Resources Officer, as well as Tracy Haas, our Safety Director, will walk each of you through things that we're doing to keep both our people and our clients safe, which is first and foremost, as we all try to get back into the new normal.
Thank you, Brandon. As we move forward, we've all seen posters like this. Maybe they're posted all over your building. COVID-19, what is it? How does it spread? What are the prevention tips? What do you do if you're sick? You've seen this, don't forget to wash your hands. I don't know about you guys, but I've not had anybody tell me to wash my hands this many times since I left 2nd grade. But it is important, and the aspect of it that helps us control some of the spread. Some of those new realities. How do we protect our building tenants from an enemy we can't see and don't fully understand? Well, that ability to understand it has evolved a lot. We have learned so much in the last 3 weeks. We've quickly gone from this, well, wait a minute, what is coronavirus? To our latest mantra is, where can I buy more hand sanitizer? Aspects and the ability to find everything we need has been a trick. So again, the safety's become a moving target. We started out saying, yes, you have to take this serious. But wait, don't panic. Wait, stay calm. There's a master method here that we just need to learn and communicate. And then, if you've had people leave your buildings, part of that message has been, we're going to let you know when you can come back. We've got more people working remotely, which brings its own channels of concerns. And I think we're real quickly getting, if you follow the recommendations of our government, to that message of yes, you need a mask. We've all seen lots of data, so I'm not going to spend a lot of time on this. This is just Iowa, the cases per day, and we can see that ramp up, if you will. We're continuously hearing about the peak. Recently, the peak has moved from late April to early May, so that's being pushed out, and I think that's a good thing. We're flattening the curve, if you will. One of those most concerning statistics are the deaths, and you can see the ramp up of these and certainly the concern associated with it. Today, a lot of our focus is on what I will call the shared future. Now, this is Iowa, and if you look at that dotted line, that's their projected deaths. But also, if you look at that big shaded area, that's the uncertainty. Those projected deaths could be somewhere between 200 and 2,000 in Iowa. So this is where the call to action for building services comes in. As facility operators, our goal is to keep that number as low as we possibly can by doing everything we possibly can to minimize the spread of this virus. Cindy?
Thanks, Gerald. I appreciate being part of the webinar today. So as you've mentioned, our top priority is to keep our Baker Group team members and the clients safe while working to maintain business continuity. The situation's been a little time consuming, and we're working very hard to monitor the World Health Organization, the Centers for Disease Control, and public health information that's available. We also try to maintain strong links to our support systems, meaning our clients who have been gracious enough to share their protocols with us, as well as other organizations, our collective bargaining groups, et cetera, to implement best practices. We've maintained regular contact with our legal counsel as well, and we appreciate their guidance and of course have been following it. This was initially a moving target as the situation unfolded, as I'm sure it was for everyone. However, it does continue to change, and keeping our eyes and ears open has proved very valuable. With respect to employee and client safety and business continuity, if we do that well, this will hopefully keep our people working without risk to our clients so that we can keep their interests advancing. Overall, this should also mean less of an economic impact to all of us as well. This is why we communicate regularly with our employees. They need to be equipped with education and knowledge of the situation, what we're doing to protect them and our clients, as well as our expectations. This helps keep them able to interact effectively with our clients and work prudently on the job. So there's two key mechanisms that we're using, an employee hotline and an employee website. The hotline, we've defined certain situations where employees are required to report to the hotline, including whether they're exhibiting symptoms, if they're undergoing COVID-19 testing, if they've had potential exposure, and if they've traveled outside of the state of Iowa. All the calls are logged and tracked accordingly, and the hotline's overseen by our safety manager, Tracy Haas, who you'll hear from here shortly, as well as our HR operations manager, and it's staffed by their teams. They're meeting regularly to vet procedures and ensure that our exposure protocols are maintained for our safety, our client safety, and of course the community. We've also established an employee website dedicated to COVID-19 that houses all of our communication. So each time we email, everything is posted there. So it's available 24/7 to all of our employees, even to those in the field. They can access it on their phone, any smart device, their computer, however comfortable. It's even been populated with unemployment resources, tool cleaning procedures, wellness and self-care tips, links to public websites tracking the spread, as well as current health official guidance about any subject related to the virus. On my next slide there, you'll see that what we're using as the foundation of our guidance. The information is on the CDC website in text form, and we've moved it to this, so it's a more easily understood format. Could we get the slide advanced one, please? Maybe a little technical difficulty. There we go. Sorry about that. So this information is on the CDC website in text form. We moved it to this format so it's a little more easily understood for our employees. We presented it at an all-employee meeting a few weeks ago, and it was pretty well received. So as you can see, the CDC recommends that we tackle the COVID-19 topic in 3 spheres: know how it spreads, how you can protect yourself, and how you can protect others. So without a basis of knowledge, sometimes our employees maybe wouldn't understand why certain processes and requirements are put in place. For example, one key component of this entire situation is that there's no vaccine at this time. That has required our entire nation to elevate this and take the actions that we have. Once our employees understand this, they may take our guidance more seriously to ensure safety. Note also that guidance regarding masks was just updated by the CDC last week. Baker Group employees were provided the CDC handouts, and we provided several links to mask making, do-it-yourself type tips as we continue to struggle with PPE orders when supplies just aren't available, as likely all of you are too. We are requiring that those who find it difficult to social distance on a job site are required to wear a mask. For example, those in close quarters or tight spaces where quote unquote sharing air or piercing the 6-foot social distancing protocol has to occur to get the job done. Also, the safety team is routinely conducting hazard assessments, and if it's deemed necessary or a client requests, then our employees are wearing masks. Otherwise, for the most part, we've been able to social distance well with staggered shifts, breaks, and lunches, as well as holding open air meetings and just general added observance of the advantages of social distancing. Much of this also requires a case-by-case analysis, as I'm sure many of you are having these same conversations. It's certainly a shared struggle. My last slide there that just summarizes the COVID-19 safety protocols for Baker Group. You'll see 8 icons on the screen there. It's just a summary of what we've implemented at a very high level, and it's a way for our employees to quickly see and know where we're at with managing this huge predicament. So also, as you can see on the left, we've implemented a daily screening app on our smartphones and other smart devices that all employees must use daily as they move from job site to job site, or if any employee happens to report to the office for any reason. This not only tells the hotline team who answered the questions in a way that requires a follow-up, but it will also help us track who is at a particular job site if an exposure concern happens to surface. Note that this isn't all inclusive of everything we've done, but again, it's a good visual. I'd like to emphasize that if any of our clients have more stringent policies, we will follow them. For example, work at some of our hospitals or in situations where close contact is nearly impossible to avoid. This has occurred and with good reason. So Baker Group's happy to work with any client in this regard. Most of what we do is deemed an essential service, so we know our clients need us and we want to be a safe choice for them to do so. So in closing, I'd just like to say we're so proud of our employees for how they've come together during this difficult time. They're really supporting each other. They're following our protocols. They pass along information to us for consideration, and they respond to our communications. They are truly concerned for our clients, and they want to do what is best to help them and keep people in our community working. So it's been a solid demonstration of teamwork to navigate through this. We really couldn't have done it with all of our employees and our client partners coming together as they have. So thanks, Daryl. I'll go ahead and pass this along to Tracy to continue the discussion.
Thank you, Cindy, and thank everyone for attending this. Some of the questions come up a lot of times: how long does this virus last on surfaces? So, according to the New England Journal of Medicine, the CDC, in the air is up to 3 hours. So, depending on the type of material, it could be on copper for up to 4, on cardboard up to 24 hours, depending on, again, plastic 2 to 3 days, stainless steel 2 to 3 days. So some of this is to be kept in mind for deliveries, when deliveries are coming to your shops or offices. Exposure protocol that we have put in place that has helped us, this tool that is on the screen right now, is a tool that we can identify with to help us determine on the hotline what type of exposure did somebody receive. So an example of that would be is if we was in a customer site and the customer site had somebody that was positive for COVID-19 or showing signs of it. So that would be person number one. If we go down into casual contact, if they was on the same floor, passing in general, not spending a lot of time with them, so we would consider that a person number three, which would be no quarantine and self-monitor at home. And if symptoms did arise, then they would be considered a person one. A person two on close contact with a person number one, we're going to consider that quarantine for 14 days until free of symptoms for up to 72 hours after symptom free. Okay. Some of that has changed here recently. If no symptoms, CDC says that they can return to work wearing a mask, taking temperature twice a day. The mask are the huge PPE in this COVID-19. So again, it's a great tool to use for exposure. It helps us also assess the, so when CDC comes out with their rules and regs and recommendations, we have a team that monitors those recommendations every day. And so we incorporate that into our facility and in our construction sites or going to clients' facilities. For instance, in our prefab shop, we can do more prefab in our shop, which eliminates more employees in one place on the site doing it. We can spread them out in here, try and maintain our 6-foot distance. Along with that, we're doing anybody that comes into our shop has to go see our foreman. Our foreman will ask them and do the daily check-in. Okay? We just can't let somebody come in and start wandering around. By the time they are noticed that somebody has already been coughed on or anything like that. So we have a procedure in place. Daily check-in screen app. That allows us to say, okay, have you been in contact? Have you traveled outside the state? If you've traveled outside the state, then, or anybody in your immediate family that lives in your household travels outside the state, we would require you to self-quarantine for 14 days. PPE has been coming a higher priority nowadays. Mask, we're using cloth mask. Masks are required if you're working within the vicinity of a person within 6 feet. Some of our job sites have higher requirements, which we are gladly to abide by. We're also staggering the shifts both in the shop and out in the field. What that means is if there's greater than 10 people on a crew, you can't have everybody checking into the job site trailer or into the office at the same time. So we're kind of staggering those shifts, start times, stop times, break times. We're adding more hand washing stations to job sites. We have our own, we also are adding more hand sanitizers, giving everybody a bottle of it, having them take them with them. Something else that we've also implemented is tool cleaning, not sharing tools. When possible, use drills, changing gloves out, a pair in the morning, a pair in the afternoon. Cleaning the tools is becoming huge because, again, on plastic, it was up to 3 to 4 days that can stay on the plastic. So we're disinfecting, using disinfectant wipes, cleaning them daily and before they come in and out of our tool crib. The other thing we're doing on the PPE is we're not only handing them PPE, we're training them on how to wear it, how to clean it, if they have to take it home and wash it. That is an important part of introducing new PPE to our employees. And that said, I will turn it over to Ryan.
Thank you, Tracy. I'm honored to get to spend some time talking to everybody today about what we're doing in our service organization to assure our employees are safe, as well as our customers and clients are safe with us working on their sites. We're doing a lot of the same things that our construction group is doing. Some of it is just to kind of keep everything uh, the same. We are working in occupied owner buildings, non-occupied owner buildings. Each technician is required to fill out the daily app before they travel to each site they go to. Several are going to different sites and multiple sites all day long. We're not allowing technicians to ride together in vehicles. That's something we kind of pushed here in the last 2 weeks, because our thought is a lot of times techs have to work with other people or even our clients in their building. And sometimes they'll ride together in vehicles, and that's way closer than 6 feet in most cases. Continuous communication with the clients and let them know what we're doing, making sure that what we're doing is actually within what they want done or above and beyond what they want done. Some clients have higher standards, and we will by all means follow that. 2 to 4 of our service coordinators, 2 out of 4 of our service coordinators are working from home. All of our project managers, account executives, anybody in the service group that can work from home is working from home right now. As you can see, Drew Kistner, one of our great technicians, I asked him for a picture of him in his PPE, and he thought it'd be funny to really go over the edge. And I think in these times we could use a little comedy.
Does
On
that
my
mean that
next,
not all of our service guys are roll of toilet paper and hand sanitizer in their belt?
I think that would maybe go over the edge, but I think the funny part is they've got a little bit of humor going in it, and these days we could use a lot of that.
Yeah.
In my next slide, talking about how we classify people based on the exposure protocol. And the reason we're trying to classify our people too is so that if we send a person to a client's location, we know where they've been, what they've been exposed to the best we can. So if there is an issue either at that location or with one of our employees, we can quickly figure out where we've been and who we've been in contact with. We're traveling to multiple sites daily. We ask all the technicians to continually self-monitor. Take your temperature in the morning and the evening. Protects our technicians and their family, as well as our clients. They're going home to their families at night, being 2 or 3 or 4, maybe different places a day. At the end of the day, they're exposing their families to everything they're around all day long. We're not allowing the technicians in the office unless they're picking up parts, and in most cases, we're having the technicians pick the parts up outside of the office or delivery. They just call in, grab it. Most of our supply houses have done the same thing. We cannot get into any of the supply houses physically. They have to call ahead. They pull up there. They can either stay in their truck or get out of their truck, and they'll bring it out to them. So that really helps the cause, keeps everybody separated, because as everybody stated, the no touching, the self-distancing, if you look at all the statistics, it's working in Iowa, and we're doing a great job of it. We're classifying all of our technicians as a person 3. Now, a person 3 does not have to be quarantined, but a person 3 has to self-monitor. And we just do that because of all their interaction throughout the day. PPE for our techs, our minimum right now is safety glasses for eye protection. That's a minimum no matter what, even before this. It helps you prevent from touching your eyes. They have nitrile gloves as needed, although we say washing hands and sanitizer is a way better way to keep yourself clean, keep your hands clean, and way more sanitary. Access to boot covers, Tyvek suits as needed if it's required on a site or somebody's looking for it, or a site has some special things we're doing that they may just want to be more precautionary. We're great with that, and we're prepared for that. Face masks, non-N95 face masks, so KN95 or cloth masks. We're trying not to utilize medical grade masks for our employees, just so that we're not taking stuff away from healthcare workers and people that really on the front lines could use that. Right now, they're directed to wear a mask. Starting in the last couple days, they're directed to wear a mask in every client's facility, unless a client deems they don't want them to have a mask on because it's maybe giving their employees unease or not, requiring a mask in every client's location. This is service for sure. Construction sites haven't went to this fully yet. I assume that in the next week it'll change. We will not require the mask outdoors unless the technician's working within 6 feet of another technician or the client. So if you're outside working on a rooftop unit out in the open air, probably good for you. Plus you're not exposing to anybody. We'll always follow any customer requirements that are above and beyond ours every time. With that, Tracy has a couple more things to talk about keeping the clients safe.
Thanks, Ryan. A couple other things we want to mention too. We want to keep our clients safe and our employees safe, and we are doing everything in our power to keep our social distancing, using our gloves, our face shields, our face mask when needed. So we're trying to assure you that our having Baker Group in your building does not add any risk or exposure risk to your employees or our techs. And with that, I think we're going to turn it over to Brandon.
Thanks, Tracy. And kind of this is a good transition point. We've talked a lot so far about how we keep customers safe when we're in your buildings and how we're keeping our employees safe as everyone goes home to their families every night. Kind of the back half of this presentation will be all about the buildings that our folks are going into. So there's been a lot of questions posed from different clients. And so what this is all about is myth versus reality and kind of some best practices approaches to your building. So as we kind of thumb through the upcoming slides quickly, thought we'd do a little bit of myth versus reality. Hopefully this is humor and nobody legitimately believes this stuff, but something, if you can hold your breath for 10 seconds without coughing, you don't have COVID-19, right? Because it's a shortness of breath thing. No, that's just a bad idea. Don't do that. Myth versus reality. I know we've all seen the studies about alcohol consumption. I think is up 18% in Iowa. Alcohol consumption may be up, but that does not reduce your risk of obtaining COVID-19. So absolute myth. I know we've all heard the one about coronavirus only affecting older people. Obviously, numerous studies have showed that this virus does not discriminate, and that we should all be aware of it. Younger people get it as well as older people. And as we understand more about the virus, obviously, additional studies in the future will kind of show maybe hopefully why that is. And then last, as we kind of transition to buildings, is locking the doors and not allowing people into my building a good idea? And I think what we've all talked about today is social distancing and working from home when you can. But the reality is, even if your facility is nearly empty or empty, it's still a building that has needs and has maintenance needs. And as building owners and clients want to be good stewards of, help you be good stewards of those buildings that you own. So we'll kind of transition into myth versus reality as it relates to buildings. Both the gentlemen from our service group, Dale Durant and Ryan English, have a lot of experience with fielding a lot of these questions. So with that, Dale, just kind of jumping in, and probably the first one from a ventilation air standpoint as it relates to best practices. Do you want to take that?
Yeah, definitely. Thanks, Brandon. So before we dive in deeply into ventilation, I want to kind of touch on, mechanically your HVAC systems can be part of curbing the virus and controlling it. But if it's the only thing you do, then you're going to be, you're not doing everything you can. It's a multi-pronged approach. Social habits, I'm going to call one of them social habits. That's the stuff that Cindy had talked about early: distancing, hand washing, not touching your face, those kinds of things. I'm going to dump that into a category of social distancing. Cleaning practices, the slide that Tracy had, is extremely valuable, and kind of understanding, the education of how long it's airborne, how long it exists on cardboard, plastic, stainless steel. So a lot of this is surface mounted things
the virus lives longer on a surface, so cleaning that surface is extremely important. It's airborne if it's attached to other particles, is what we understand at this point. And so it doesn't survive as long in the air as it does on surfaces. So getting it back to your air handler, scrubbing it, there's strategies we're going to talk about related to HVAC practices, but it's got to be part of other practices that you're implementing, social distancing and cleaning practices. So within the HVAC practices, kind of the main categories of strategies that you can implement: ventilation. We'll touch on ventilation. There's a lot of questions about filters. HEPA filters, is that the answer? So we'll touch on that. There's also other technologies that exist that kind of act as a filter. It's not an actual filter media, but it's a type of system that you put in an air handling, either a new air handler or retrofit into an existing. And then also there's a strategy around humidity control that we'll touch on and kind of talk about the pros and cons of those different approaches. So increasing ventilation air, like I mentioned, the virus can live in the air, from what we understand at this point, for approximately 3 to 4 hours. So extra ventilation, implementing that into your building helps purge air that's in your building and turn it over more times an hour. So us nerds in the mechanical design world, we talk about air changes per hour. Most buildings, the outside air ventilation air, well, if we pick on an office building, for instance, is based on the number of people in the building. So if we set that strategy aside and we kind of think more about number of times you're turning over the air, most of your systems are designed for bringing a certain amount of air per person. Increasing the ventilation air is kind of a seasonal thing. Once we get into state fair type weather, your systems, the thing to keep tabs on is if your system is able to produce the cooling it needs to. And so keeping that in mind as we bring in more outside air, we implement an increased ventilation strategy. Keep in mind that in the dead of summer, that strategy might need to be trimmed back, but then once fall hits again, you can increase that ventilation air again. Talking next about filters. So this is probably the most common question that comes up is around filters. So from what we understand of the virus, so the virus is part of a larger family of viruses. Coronavirus is the larger family. The current virus that we're dealing with is called COVID-19. SARS, if anyone remembers the SARS virus, that's also a coronavirus. The size of the particle, if you think of a human hair, the COVID-19 virus is about 1/800th of the size of a human hair. So trying to capture that in a filter is very difficult. HEPA filters, if we talk in micrometers or nanometers, is a 0.3, or excuse me, a 0.1. And a HEPA filter will go down successfully and efficiently go down to 0.3. So this is a third of the size of the particle that even a HEPA filter will catch. So for the most part, with a couple of limited exceptions, changing your filters to a HEPA filter is certainly not going to solve it. It probably won't really curb it at all either. It'll actually, most often it'll cause problems with your air delivery. It'll slow down the amount of air that your air handler is able to move. And so you'll actually have less air distribution and fewer air changeovers. So it's not something that you want to just blindly replace an existing filter with a HEPA filter and think that it's going to be a strategy. You want to continue to change your filters on a regular basis. So if they are catching something, that you're grabbing that and getting it out of the airstream as quick as possible. I'd mentioned a little earlier UV technology. Ryan, if you want to touch on that.
Sure, thanks, Dale. One other thing I wanted to clarify too, I got a text message from one of our people that said, hey, we should also mention this. And one thing that's going on with service technicians is we have a lot of service technicians that are dedicated to certain buildings. And some of those buildings have asked, hey, if you've been at a hospital or you've been in a care facility, you've been in a clinic in the last 14 days, we'd prefer you not be in our building. And we respect that fully. And that's happened in a couple of cases, and we're very respectful of that if that is a concern of yours, especially in healthcare facilities and adult care facilities and stuff like that. So, and with that, UV lights and air handlers. UV technology has been around for a long time. UV, it does a great job when installed correctly of improving indoor air quality. Think of it as laying in a tanning bed. The longer you lay in the bed, the more burnt you get. It's the same thing. The longer time it has, or the more time it has to burn on a surface, the better job it does to clean and kill whatever's on that surface. They've been around, like I said, been around for a long time. They're usually on the coil section of the air handler, lighting the coil section of the air handler. Part of it was to keep the coil clean. Part of it was to keep smells down and stuff like that in the air handler, not letting bacteria grow. So that's what they've been installed for a long time. Effectiveness in the airflow stream is totally based on the intensity. Just like I said, if you sit in a tanning bed for a long period of time, you're going to get burnt. The slower you move air across it, the more and the longer it can burn that air, the better job it does. Plasma ion systems, the so-called magic of air purification, and something that has been around for quite a while now. It's very interesting. I cannot tell you that I'm a subject matter expert on it. I've done a lot of reading up on it here lately. It is a very different option than UV, but very effective at improving indoor air quality in the airstream of the air handler. It does a good job in the airstream because it's actually using ions to basically get the particles in the airstream to bunch up and get caught in the filter. And when it's doing that, it's separating anything that's not a particle away from that particle, so it can be basically burnt off, just like you're wanting to see happen. And so you've got to get whatever, you know, if you say this has been tested with SARS and everything else, and if you say that SARS can live on a particle, you've got to get it off that particle so you can kill it. And so as it comes off that particle, the negative ions will basically burn it off or keep it from reproducing just like you'd want it to do. It does an excellent job of odor control as well. And it's another option out there, but I do want to stress that in your facilities, a UV system and a plasma ion system would be an extension of what you're doing to protect your employees. Again, this is technically not an airborne problem, but at the end of the day, your cleaning practices and your distancing practices are going to be key to success as well, and probably number one key to success.
I'm going to spend a little bit of time talking about potable water systems. But before we completely depart the technology of the UV and the ion plasma type retrofits to existing air handlers, both of them can be successful. They have different pros and cons. The UV lights, for instance, have a higher annual cost of ownership. From a maintenance standpoint, the lights need to be changed approximately annually. And you have to, with both systems, you have to be really careful that it's designed properly for the airflow that you have and the physical size of either ductwork or air handler that it's going into. The UV does a better job of burning something that's on a surface, and I think that the plasma does a better job of an airborne type. And so you could install both systems on the same air handler and it be effective. But you would want to make sure that it's the proper system and it's maintained along the way. Potable water systems. So if you put your building into hibernation and you don't go in, or maybe you have very, very infrequent use of the domestic water system, this is completely unrelated to COVID-19, but it's absolutely related to vacating a building and then coming back in a couple weeks later and occupying that building again. So we felt it was pretty important to include this in the conversation. So if you're out of your building for 2 weeks or more and your domestic water system for the most part has not been used hardly at all, you want to go back in, and ideally you want to flush all the water that's in your piping system, get that flushed out. if you understand, the best way to do it is to understand how your piping system is laid out, so you make sure that you're flushing all the branch lines. If you have a couple of bathroom groups, you know, the flush valves on the urinals and the water closets, they move a lot of water quickly, so that's a good spot to get some water flushed out. And typically you have a larger branch line that goes to those, so you'll have some stagnant water there that you want to get flushed out. And a full flow on a domestic water system on a pipe, typically the water's moving around 7 feet per second. So as you're trying to figure out how long do I flush this water, how long do I need to leave a hose bib on, there's two parts to that. One part is understanding your piping system and the branching, make sure you're flushing all those branches out. And then probably 45 minutes is a pretty typical window of how long you're going to need to flush that with more than just one sink running. So you'll consume some water, but it's all in the spirit of getting that stale, stagnant water out of your piping systems, because you don't know which part and which branch line somebody's going to be drinking from. So again, this isn't a COVID-19 thing, but it certainly is a unoccupying or vacating your building and reoccupying it. And so we thought it was important to include that in this conversation. Next question we have is related to, you know, maintenance. Hey, do I just put my maintenance on pause as well? So Ryan, if you want to spend a little bit of time speaking about that.
Sure. We've had a couple of clients, not very many, but so some clients that are in a situation where they're not able to do anything with their facility at the time, not able to generate revenue, not able to occupy the building because there's really nothing they can do. Those are the ones that have called and said, hey, what do we need to do to keep this building costing us as little as it can, but we don't want to just let it go. And that's a good point. We're going to come out of this. You know, this may be a month down the road or a few months down the road. You're going to want to use your building again. You're going to want to make sure it's well taken care of. And with that, you still want to run your systems in a way that you can keep your humidity level down. As we're going into spring and getting into summer months, you don't want the building filling up with a bunch of humidity. Temperatures increase outside, humidity increases outside. Want to keep the building slightly positive still a little bit. Keep your temperatures, even if you're in a night setback temperature, keep your building temperatures up a little bit, but still run your systems. And then the whole continue to do your preventative maintenance. You will be back in your business soon. You'll want a full function of your facility. The last thing you want to do is not run your building, create a bunch of problems from humidity, smells, whatnot, and then not take care of it and have it ready to go when you're ready to use it again. That's huge. And that's why we're trying to make sure we're being safe with our people. So you'll allow us to come in your building and make sure it's operational and make sure you're in a good place so that when you're able to occupy your building again or utilize your building to its fullest ability, you can still take care of your customers and take care of your employees as well. And with that, I'll give it to Dale about looking into the future. What's this future hold for us? And if I tell you what, if I knew, it would be pretty cool to know. But it's been a whirlwind in the last 45 days, and I think everybody's kind of all in this together. So.
Yeah, thanks, Ryan. So by no means do we think we end up getting shoved back to the Stone Age, where we talk about we used to have airplanes and we used to have cars, and but there will be a shift in how buildings are operated, and it'll all be in the spirit of making it better, making it healthier. And again, it'll be centered around some of those strategies of not only HVAC practices, but also floor plans and how they're laid out and controlling traffic. So one of the things we wanted to touch on, again, you know, the increased ventilation, humidity control, and specialty HVAC containment. So we haven't touched a whole lot on humidity control yet. In a couple slides, we've got a graphic that shows that, and we'll touch on it then. But you know, ventilation strategies, again, as they come down through the building, mechanical systems physically are going to look pretty much the same. It's not like an automobile where they come up out with a new model this year and it's got better curves to it. Mechanical systems and air handlers are going to look the way they always have. It's going to be more the strategies on how you're running those set points that you're pursuing. And if you're bringing in more ventilation air, for instance, that will affect the size of your chiller plant if you have chilled water. If you don't have chilled water and it's a packaged rooftop unit, it'll just be a larger unit. But again, that'll all start, the infancy of that will be based on ventilation air and how much ventilation you're bringing in. That's what we see as the biggest change in the future to buildings. And ASHRAE really is kind of the leading group on that, the design, the ventilation code requirements and whatnot. So ASHRAE will certainly be the leading edge of that to make sure that that's implemented across the nation.
Dale, this is Daryl. We talk about ASHRAE. ASHRAE always establishes the minimum ventilation, and clients have had an opportunity to overventilate or add additional ventilation, but many haven't over the years. You want to talk about that just a little bit?
Yeah, definitely. So systems that are installed and what they're capable of doing, like Daryl mentioned, ASHRAE establishes the minimum amount, and a lot of times ventilation for, again, I'll pick on an office building. The driver of that is your CO2 levels. That's what we look to tell us really the indoor air quality. And so the strategy around that would be, typically we're shooting for 1,000 parts per million of CO2. You can lower that outside CO2 levels are maybe around 350 to 400 parts per million. So you can start working on dropping that from 1,000 parts per million down to 800 maybe, and flushing your building out better that way. And that will automatically force your air handlers to bring more ventilation air in. But Daryl's right. ASHRAE establishes that minimum requirement, and building operators, as you operate that building, can certainly ventilate it beyond what the minimum code requires. And a lot of that, your CO2 levels is really what is the indicator of your ventilation rates.
Sometimes also, I know, working with building owners, the energy costs end up being a big thing. So the minimum ventilation ends up also correlating to the minimum, if you will, energy cost. Adding ventilation means more conditioning of the air, winter, summer, spring, fall, and adds to the energy cost. So a lot of people have stayed away from that. But as we think about the future, I believe that people are going to look a little more at the operating costs of the healthiness of the people in their building, and therefore maybe add to the ventilation to improve the air quality for the people in the building, and accept the fact that it may cost just a little bit more in energy. Is that fair?
Yeah, that's dead on. The more ventilation air you bring in, the more utilities you consume to temper that. Other strategies around that might be some heat exchangers, some dedicated outside air ventilators that have those heat wheels in them. So we see buildings that have some of those strategies implemented already, and that would be a way to capture some of that energy and help save energy, but increase ventilation.
Makes sense. We see that same thing happening, the cost associated with the humidification. You want to tell us a little more about that, Dale?
Yeah, so this slide it really is a graphic that represents 40 to 60% relative humidity is the optimum spot, and that's for multiple different reasons. People are comfortable in that range. Buildings operate better in that range, and it controls in that range. You do better mold control, you do better virus control. Viruses grow better. Viruses like coronavirus, COVID-19, they're more healthier in a low humidity setting and a high humidity setting. In that 40 to 60% range, they'll still exist and they'll still be around, but not as healthy of a virus if you want to look at it through that lens. Same goes with mold. Mold, anything above 60% relative humidity is when you start growing mold. And so paying attention to your humidity levels is extremely important. And humidity sensors go out of calibration quite often. So even if you have a humidification system in your building, making sure you're checking that humidity sensor. And make sure that it's reading correctly, because that's really what controls your pumps and your air handlers and your speed of your fans and all that kind of stuff. So making sure those sensors are calibrated on a regular basis. If you think of buildings in this climate, when it's below zero, most building envelopes, unless it's a really, really tight building envelope, most building envelopes have issues if you have humidity, above 20%. But if you look at 20% and optimum is 40%, if you're at least 20%, how much better that is than if you're at 10%. So a building that has no humidification at all in the wintertime in Iowa is typically going to be around 10%. So if you have some humidification and you're able to run it even at 20, that's significantly better than at 10% in controlling not only viruses, but also other contaminants in your building and controlling your indoor air quality. One last slide. If we look to other things in the future and other options, everybody's familiar. Most people are familiar with the term HEPA. The one step beyond HEPA is HEPA is an acronym, High Efficiency Particulate Arrestor, which is the step beyond HEPA. Ultra low particulate air. That's possible, but it's not practical. ULPA filtration systems are used in clean rooms. Most, and by most I mean probably 90% or more surgery suites don't even have ULPA. Most surgery suites have HEPA filtration. ULPA filtration is extremely expensive and it costs a lot to maintain. So for an office space or any space other than maybe a clean room environment or a really high-end surgery suite, from a financial standpoint, just is not practical. But ULPA does exist. But even the COVID-19 virus would still get through most ULPA filtration systems. So even though it's not practical and probably not something people are going to implement, we wanted to make sure that people were aware that exists. But you need a lot of infrastructure in order to have that system.
So this is what we'll roll into kind of a Q&A session, if you will. We've got our pictures of our panelists back up there, and what a good looking group they are. We'll try to answer some of the questions that have come in. If you haven't already typed up your question, please do. We'll want to answer those as much as we can.
Thank you, Daryl. And so that kind of concludes the prepared content for today's presentation, and really wanted to leave these last 15 minutes open for as many questions as we could get to. One of the first questions that we received out of the gate is, you guys have talked about plasma and UV. Which is better for killing COVID-19, and do either strategy really kill it? So with that, Dale or Ryan, do you want to provide an answer for that question?
Yeah, we certainly can. Ryan, do you want to take a crack at that, and then I can add some additional commentary?
Yeah, absolutely. So, it's one of those things where if everything's in the right scenario, nothing has been kind of proven to kill COVID-19. Now, COVID is everything's been tested against SARS because SARS has been out for a while. Nothing's really been tested against COVID, but they're such a close family member that the assumption is that their ability to kill COVID is the same as their ability to kill SARS. Each system has its goods and bads, but neither one of them is a bad solution to your air handling system if depending on what you're looking for. At the end of the day, I still want to stress that right now this is not an airborne problem. It's more of a surface problem and what it attaches to on the surface. The UV does a way better job on surface, and the plasma does a way better job on the airborne side of things. And so as it's in the air, the plasma is working in the air. As it's on a surface, the UV is working in the surface. UV does a much better job on the surface just because, like I said, in a tanning bed, the more time it has to touch something or be in front of something, more time you spend in a tanning bed, the worse you're going to get burnt. And I'll let Dale add to that.
Yeah, probably the only thing that I would add to that would really be if you're a building owner and you install these systems, the UV system, let's assume you install one or the other, and you install a UV system and assume that both of them are properly sized for the physical area they're covering and the CFM of air that's moving through it. So out of the box, both of them are going to be effective. The UV, you're going to need to pay closer attention to the UV because the UV bulbs burn out, and the intensity is really what matters. The intensity of the UV light is what matters. So if you look in the air handler and you see that there's this glowing inside the air handler, and you think to yourself, hey, the UV bulb is still burning, I'm okay. That's not always the case. So approximately every 12 to 18 months, you need to change those, and they're a couple $100 a piece. And so a UV system is going to require more intervention throughout the life of it, and you'll need to make sure that the intensity of that lamp is as intense as it was when it came out of the box. So the plasma is a little bit more foolproof from that standpoint, but again, it starts with both systems. It starts with having the proper system sized. And so if I'm a building owner, kind of circling back to this question, I think the one that's a little bit more foolproof is the plasma. But both of them kill the virus, but I wouldn't lean on that as your only strategy.
You know, I think there's also an aspect here that both Ryan and Dale touched on, and that's that every building is unique. We would want to look at your particular scenario. For example, we talk about the length of time the virus can remain alive in the airstream. We need to look at what's the return path from the space your occupants are in to get back to the air handling unit. A lot of open returns and ceiling plenums, that velocity is slow enough that virus might already be dead before it gets back to the air handling unit. The flip side of it is if you've got smaller zones set up by small air handling units or small rooftop units, it might be more applicable to apply it in that case. Each building's going to be a little different.
Another question received, we talked about ventilation as a strategy as clients are moving back into buildings. One of the questions that came through was, does the energy code dictate the maximum amount of outdoor air? And again, Dale, Ryan, any of the panelists, thoughts on that question?
Yeah, I'll take that one. The code does not give you a maximum ventilation air. The thing you're going to need to pay attention to is making sure that your systems can handle that. So if you made up scenario, let's say you maximize your ventilation air today, but your systems are not designed, it'll work fine during the shoulder seasons, but you'll start losing control of your building and the humidity levels may creep up in your building. So you've got to pay attention to 4 or 5 spinning plates all at the same time. But there is no maximum ventilation, but you want to make sure that you're not slugging your building full of humidity. And you also need to make sure that you're not over pressurizing your building and causing other operational issues.
And the one thing I wanted to add to that too is that question has been brought up by several customers as well. Do I increase my ventilation? And like Dale said, it's added energy costs to heat and cool that outside air. The one thing you want to keep in mind also is as we get into these rainy, sticky, hot summer days, the more what we see on air handlers that bring a ton of fresh air in, whether it's something that's designed to do that or something that maybe malfunctioned and is bringing a bunch of outside air in, you will see your mixing sections potentially get dirtier, as well as your humidity levels become such in those mixing sections before you get to your cooling coil that you develop some mold and you develop some, and I'm not saying all mold's bad, I'm just saying there's some things that happen in there biologically with the more outside air you bring in that also affect what the inside of that air handler looks like too.
Thanks, Ryan. Many companies are discussing phasing back into their buildings. If you're a building owner and you have that as a strategy to phase your people back into your buildings as we come out of this, does that strategy change some of the strategies we've talked about today from an HVAC standpoint? Daryl, what are your thoughts on that?
We're back to that ventilation code. If we've made it a conscious choice that we want to add additional ventilation and we've decided our systems can handle it, we're going to push a certain amount of air changes per hour. Now, when you start thinking about spreading people out in that space versus having them a little more dense, that's not going to change the number of air changes per hour. That's going to be dictated by our fans at this point. I think there's some other things we can do when we start phasing people into the building that are less ventilation oriented, if you will. I think part of the articles that I've read about phasing people into the building is I'll start talking about the new normal. How are people going to behave when they're used to the social distancing and now we're coming back in and perhaps having meetings in conference rooms again? I think there's a observation of the social behavior that people are comfortable with. It's going to be so different than it was 6 or 8 weeks ago that we're going to want to phase people in to see how people are reacting, see how comfortable people are, and learn from that first phase of people so that we're in a better prepared for perhaps the second and third phase. Anything you guys want to add to that?
I would agree. Nothing additional.
I agree, Daryl, that it's the whole saying with the social distancing and not letting our old ways come back into play right away.
Thanks, guys. An additional question that came in again around ventilation air changes. Is anyone here recommending a certain number of air changes per hour for a space? What are our thoughts on that?
Yeah, I saw that question up there and I ran some fast math on an imaginary building. If you had 200 square foot per person and you're bringing in 20 CFM of ventilation air, that ends up somewhere close to half an air change per hour of ventilation air. Now the amount of air that you're moving, typically in an office building, we'll pick on that as a for instance, 15% of your total air is fresh air. So you'll have more, don't get confused with the amount of air there, the air that your air handler is moving compared to the amount of fresh air. Those are two different things and they travel down the same ductwork typically. So air changes per hour would be about 0.5 air changes per hour. Get you a pretty well ventilated building. There are strategies that have been implemented typically in the spirit of energy conservation that reduces that amount of ventilation air based on indoor air quality. But half an air change per hour is a fairly healthy rotation.
I'd just like to add that that's a great example, but it really applies mostly to an office building. Certainly there are other special use facilities, whether it's laboratory or medical, that may certainly have different recommendations for air changes.
Good point, Daryl.
As we go into the spring months and we continue to talk about ventilation, what about additional allergens brought in during the spring months? And as building owners are all trying to be stewards of their buildings and do the right things, what do we recommend there? Ryan, what are your thoughts?
Yeah, that's a great point. I would say what you'll find is if you have a building that is normally brings in its minimum outside air, and let's say you increase that by 10%, the number one thing you're going to probably see is your ventilation filters are probably going to get more dirty in your unit. So if you're used to changing your filters quarterly, you might have to change your filters on a every every 2-month basis, maybe, to keep track of that or keep up with it, especially with the pollen. If whatever, kind of depends on what the pollen count is doing in the air at the time. But that is definitely something to think about. Is the more fresh air you bring in, you will bring in more pollen and more outside air conditions. And that's probably one of those things where it's not a bad idea to, you know, I the part about it that I am not, I'm not the expert on would be allergens. You can change your filters in your unit. You could maybe go from maybe you're at a MERV 8 right now, maybe you go to a MERV 11 or a MERV 13 filter, but that's also something you have to be very careful of too, because you're also changing the performance through that air handler or rooftop unit, because you're restricting that air a little bit more. Going up of maybe one in a filter to maybe just a hair better filter if you're bringing a bunch more outside air in, maybe. But I really don't recommend doing really mass amounts of fresh air. If you want to increase it a little bit and get a little bit more fresh air in the building, but my recommendation would be not to bring in tons of outside air. For one, your energy costs are gonna definitely increase, and it definitely affects how your piece of equipment works and what it's used to actually doing.
Thanks, Ryan.
Hey, one thing that I want to ask as well is kind of a tail on to that. We've talked a little bit about UV and plasma in order to be able to capture some of that. Adding that in your air handling unit, does that collect and take care of some of these allergen potential?
Yeah, the plasma system definitely, because it bunches all that up. That's what that's kind of designed to do. Is your plasma system is going to take whatever's in the air, it's going to get it all bunched together and try and get it trapped in that filter. So that definitely is going to do a good job of that. And whatever gets trapped on your coil in your UV system, depending on how your UV system's functioning and performing, or how it would be designed, you're just going to try and burn off whatever gets through that filter and maybe to your coil.
Thanks, Ryan. As we're wrapping up, looks like we have time for one more question. Just kind of the last one that we got in here. You guys are a top-notch security provider. Have you seen a heightened awareness around job sites or existing buildings? I would probably answer that one from a job site standpoint. Definitely seen the heightened awareness around job sites. I know many clients, luckily, because it helps keep our people safe, have taken this very seriously and have established protocols that they want to make sure that we're following, as we also follow our own. Many clients have safety staff dedicated really to COVID awareness, social distancing, and making sure protocols are followed. In fact, I can think of a couple off the top of my head where there is a staff member on site that's what they do all day, every day, which we welcome. When our clients are taking it that seriously, and the trade partners are taking it that seriously, you're going to have the best chance of reaching the ultimate goal, which is to keep our people safe, keep our clients safe, while also helping our customers succeed in what they're building. On existing buildings, I would echo that as well. Many of the buildings that we're in right now have check-in protocols, definitely a heightened awareness around security, who they're letting into their building, and what protocols those companies have in place. Again, just no different than a job site. The more serious that's taken, the better and more comfortable we feel sending our people there. With that, we will kind of wrap it up. I know we have several questions related to sending this PowerPoint out to people that were on the webinar. If you would like to get a copy of that, please email the webinar address, and we'll make sure and get that in your hands. And Daryl, really the last slide from a presentation standpoint. So the takeaways that we've talked about today, do you want to round those up?
Yeah. First and foremost, thank you guys all for participating with us today. Your questions were excellent, and we all learn from each other in this process. We're all in this state of flux, and we're learning about what's best. couple of the key takeaways then, certainly safety is a strong cultural value. And when we say safety, we're really talking about our own employees, because they're going to come to your site. So the best way we can keep you safe is to make sure our employees are safe. And ultimately, we want our families to be safe. Part of our discussion today is that you do have some options for some indoor air quality improvements. But every building's different, and there's so many different strategies. I don't know about you guys, but I've gotten lots of emails about buy this product and this will solve a problem. Let us help from a pure standpoint of what makes the most sense for your building. What's going to give you the best bang for the buck and all of that. We've got the abilities in-house to help you with that. And a lot of that area that we can help you with is to reduce your risk, proactively help you manage your facility during these uncertain times. When people do start coming back, they're going to be asking questions. Is it safe for me to come back? What have you done to make the environment safer than it was before? We talk about the new normal. I'm not even sure what that new normal is going to be, but we know it's not going back to the way it was before. So how do we prepare ourselves for that? How do we prepare our building for that? And how do we communicate to people that it is safe to come back in the building? Because here's the proactive things we've done to make it better. So again, thank you for participating today. A couple have asked, as Brandon mentioned, we're going to give you, anybody that wants it, a full copy of this presentation. Baker Group also has a COVID-19, we call it a client packet. It's documentation of what we're doing to keep our people safe, to keep you safe. And we've also developed a white paper, just a one-page simple form. What are some of those HVAC best practices? And interestingly enough, the page spends almost as much time on what doesn't make sense in general as it does about what does make sense in general. So let us help you. We hope you found this valuable today. We hope you found it to be a good use of your time. And again, I want to thank Brandon for helping to moderate, Ryan English, Dale Drent, Cindy Summers, and Tracy Haas for your participation in our informative webinar today. Thank you again. Have a safe and good day. Bye-bye.